Good morning. My name's Dr. Jack Taunton. I'm a sports and exercise medicine consultant and specialist. I've got a BSc and an MSc in kinesiology from Simon Fraser Charter Students. Then was the first from Simon Fraser to actually go into medicine. Did a medical degree and then what is now called a residency. It was called an internship there from St. Paul's Hospital to prepare myself to do emergency medicine and family practice. Wanted to do sports medicine, but at that point, sports medicine didn't exist. And we were lucky enough to be able to change that. I have a specialty in sport and exercise medicine through the Canadian College of Family Practice, and I'm a fellow of the American College of Sports Medicine. So everybody wants to know, what is sports medicine? And sports medicine is really the whole science of the role of exercise and its benefit to all ages, to the young, to seniors, to high performance athletes, and individuals that have chronic disease. It could be arthritis, could be asthma, could be diabetes. You could have cancer, and I've developed a cancer exercise program at our clinic, the Alan McGavin Sports Medicine Center at University of British Columbia, and have done that with my partner. And more recently have developed a center for chronic disease, brain disease, and this is for people that have Parkinson's, MS, Alzheimer's, or mood disorders. Maybe some of you have had depression or anxiety, and exercise is very effective in helping that. And those that have had concussion from sport or a motor vehicle accident, had a head injury, and then have had ongoing symptoms. So it's the effect of where exercise can improve your status, can prevent disease such as cancer and coronary artery disease, heart disease. It can be very, very effective in in rehabilitation. And so with that, and they didn't have an education program, a fellowship program. My partner and I, 41 years ago, co-founded the first sports medicine center at the University of British Columbia, and then developed the whole educational program that went along with that. So that was a long time ago, 41 years ago. And I've recently retired, and I'm now what's called a professor emeritus. And so these are professors that have basically retired. I've retired because of my health from doing clinical practice, but still very, very involved in education, in research, and particularly in fundraising and putting on special events. Special events such as my wife and I started the Sun Run. And I was a co-director for 20 years. Two of us started the Vancouver Marathon. We started the Seawall race, and now my wife and I put on pro-am bike races. So everybody wants to know, okay, what's a day in the life of a sports medicine doctor like yourself? And you have to realize that I've got an academic base at the university. So I'm a tenured professor. But our day would start off seeing patients that are referred to us with a myriad of problems. They may have an overuse knee problem, they may have a stress fracture. Because I've done so much running myself and started these races, I was a pretty serious competitive marathon runner. I've run 120,000 miles or 200,000 kilometers and ran 63 marathons. So a lot of the stuff that we see are runners. But I also competed as a cyclist for a number of years, so I see cyclists. My master's degree at Simon Fraser was one of the very first cardiac rehab programs in the country. So I see patients that have had cardiac problems that may be a result of too much exercise, or often it's a result of either they've inherited this or not sufficient exercise. So we see patients that are referred. We do see some patients that are not referred, and those would be athletes that I look after, the whole team. And like I've looked after the women's field hockey team, our national team, for 30 years, the men for 20 years. I looked after the Vancouver Grizzlies, the NBA team, while they were here, and during that time looked after the Canucks and the Canadians baseball team. And because of my interest and research in running, I've looked after the SFU track team from my old roots, and I also worked with the wrestling team for a number of years, and I worked with women's basketball and men's basketball for quite some time. So your day is clinical work, education, so it could be, and you're teaching, and when you're at a university, you will teach as you're seeing the patients. You will teach young doctors that are going through either medical school or particularly have graduated and they're in their residency, which is a 2-year program in family practice, or doing a specialty in emergency medicine as an example. And they work with us, and then we have a fellowship program. And this is to get that sport and exercise medicine certification. We started the very, very first one a year after we opened up the center at UBC. So clinical work, education, and also in education, Friday afternoons, my partner and I taught 2 courses for well over 30 years. They said they were the most popular courses that the kinesiology students took. Case study, so these were actual patients, that we had actual charts, which they would ultimately, if they got established the history of how did this individual injure the knee, then they get the chart, and then they present the case, and then write that up in the style of a journal, and that you put all those papers together, and that's your exam. So the first course was sport and exercise with the musculoskeletal system, muscle, tendon, bone, torn knee ligaments, fractures. If you're a basketball player, you'll all know about, if you're young, it's Osgood Slatters and a growth center in the knee, or it's jumper's knee, the patellar tendon. Or if you're a runner, it could be Achilles tendonitis, it could be a stress fracture, it could be a compartment syndrome. The other course is what we call basically exercise is medicine. And this is the effect of exercising in different environments, maybe at high altitude. One of our doctors has a clinic at the base camp of Mount Everest. And so he's looking at individuals to prevent high altitude pulmonary edema or cerebral edema, fluid on the lung, fluid on the brain. And if you don't acclimatize and you go up, just fly in and then try to climb, and you don't have to be at Mount Everest. You could go down to Mount Baker and virtually get it. Or it could be cold exposure. It could be from the heat stroke, which is one of the very few conditions that can, unfortunately, kill a very healthy individual. Heat stroke, running in the heat where you haven't adapted. It could be from diving aquatics. Or we go through all the systems. Your brain, it may be that you have seizures. Maybe an eye injury. You're playing basketball and somebody pokes you in the eye and you get a retinal detachment. Maybe your lung, where you do have, as I mentioned, exercise-induced asthma. It may be your heart. It may be something you were born with or you've acquired. And because of this, and it's ended up running into a number of tragedies where young athletes or older like mom and dad, over 35 to 40, they are asymptomatic, don't have any chest pain, don't have any symptoms related to their heart, but they have coronary artery disease, and with maximum exertion can unfortunately die. And it's because of that that I've, along with a tremendous cardiologist, Dr. Saul Israel, we've started a program called Sport Cardiology BC. And we've just finished studying 1,860 under 20-year-olds, and 100 of them had a potentially lethal condition with exercise. And we have just finished with one of our graduate students studying 900 masters athletes. This is over the age of 35 to 40. No symptoms, but they collapse and may end up either having a very irregular heartbeat or have a heart attack, and it could be fatal. So we test them. We take a history on them. We do an exercise stress test, and we look at your electrocardiogram, so that and it could be in your bowels, your bladder, all can be affected with with exercise itself. Besides education, we do a lot of research. I've done 30 years of research with the Nike research arm, which is called Nike Global. And so we look at new shoes or new apparel that comes out. How safe is it? Do you get injuries with it? We've just done a very, very exciting study where we trained 250 people. We put them in various shoes, trained them for 12 weeks, and they run a half marathon. And a shoe that came out of that was the one that created a significant reduction in injury, 52%. Most shoes, if they can reduce injuries by 30%, everybody's very pleased. But I'll tell you, the Nike company was very, very excited with this shoe called the Infinity React. The React is the midsole material, and it reduces the ground reactive force, your impact. Is one of the risk factors causing stress fractures or other injuries to your lower leg, and it reduces the ground reactive force by 86%. And we've just started another study in the last 2 weeks. We've got 305 runners. We've got 3 prototype shoes. One of them will see if we can improve on the Infinity React plus other shoes. And then I've done a lot of research on heart disease and how can we prevent heart disease. I've done a lot of research on seniors, and we've put your grandma in a gym, and she's never been in a gym before, and they're doing weightlifting, and they become more independent. They can climb stairs. They can put away their groceries. They don't fall, and when they fall, they don't break bones, which happens certainly with seniors. And the other area that I do a lot of work in is fundraising. As I mentioned, we've just opened a brand new center at University of British Columbia, and I've raised $3.5 million myself for that new center. I put a track on the roof, so for individuals that need recovery, we've got a great surface. I've put imaging equipment that is, one is to measure the bone density. Could be in the seniors or men, and particularly women. If they do too much running, that turns off your hormones. For a woman, estrogen, progesterone; male is testosterone, and your bone density drops, and you get stress fractures. And that's a unit called a DEXA. And then the other is, since I've done so much work on tendon problems, we've got the latest ultrasound that looks at overuse training, the effect on a tendon. You can get micro tears, and then under ultrasound guidance, we can heal those tears with ultrasound guided injections of dextrose, sugar, or your platelets, which clot your blood, but they turn on the growth factor, and then we can heal the tendon. So right now we're doing a huge project. that's been very well funded on masters athletes with osteoarthritis. So this might be mom or dad, and they've had a previous knee injury. They've torn their anterior cruciate possibly, and now they've got arthritis, and nobody really knows how much exercise they can do. Well, now using a very, very powerful MRI, magnetic resonance, we can look at the thickness of the cartilage, the strength of the bone, and we can look at the strength of the muscles, and that DEXA unit can do, the same thing. So certainly research is certainly critical. So the other activity that it occupies a good part of my day, and now, because I was born with a spine defect, and I've had 7 major spine surgeries, and I can't bend forward. I got 2 3-foot rods in my spine, and I got a body brace, so I can't do clinical work. I can consult, but what I do is teach, do research, and then fundraising. And as I said, I raised $3.5 million for our new center. $1 million went to establish an exercise program for people with cancer, and it works. Particularly, and we started, Don McKenzie, my partner, started with women with breast cancer. And if you exercise while the woman is undergoing radiation or particularly chemotherapy, add exercise to that, and that alters the gene causing the cancer. And those individuals survive. The other thing that I've established, as I mentioned, in our new center is a gym for individuals with chronic brain. So that's people with Parkinson's, MS, people with dementia, Alzheimer's, depression, anxiety, and those with chronic concussion. And it's interesting, if you go to the gym and you really work your quads, that releases a growth factor that turns on a factor in the brain. It's called the brain-derived neurotrophic factor. And so really exercise your quads, and the neurotrophic means new nerves, and that's what people with dementia lose, and new blood vessels. So they improve. And so I was very excited about that. I've also developed wellness programs to assess and monitor the health of our firefighters. For Burnaby Fire, we have about 288 firemen there. My son-in-law is one of the senior firefighters, hence I'm involved in that. And we've moved out to Taunton now, and I run a wellness program for the Delta Fire. So we check their heart, we check their brain, we check their lungs, we check all their joints. They're lifting and they get knee problems, they get back problems. It's the highest risk activity for causing early heart disease with firefighting. And a lot of that is partly it's stress, and partly it's really related to the toxic fumes that they inhale, which are not too good, on your heart. I've also, 3 of us have, in the last 4 years, have funded and have opened a sports medicine center in Uganda. And it's an emerging country in terms of sport. They, just as an example, one of the most common injuries that your friends have suffered, they're playing soccer or basketball and they rapidly decelerate. They stop quickly and they tear the major knee ligament, the anterior cruciate. In Uganda, until we came along, the treatment was to amputate the leg. So the first thing that I did, I went out to friends with a company called Osser that we do a lot of research with, and they have a brace that controls an unstable knee, which has had its ACL torn and hasn't had surgery, or with tearing your anterior cruciate ligament, you get premature arthritis, and it's an anti-arthritic brace. So they've given me 500 braces. Another friend of mine has given me 500 pair of shoes. And the Paris Orthotic Company have given us orthotics to control if you've got really flat feet, you're more at risk for running injuries. And they've given us all the equipment for physiotherapy and for orthotics. So we go for 2 weeks group of us, and we examined 125 of the junior national team or national team. We found there, and when we did that, and we do that for that 2-week period, so we're seeing all our athletes that over 50% of them had muscle tendon injuries. How do we diagnose that? An ultrasound. So I put on a fundraiser, and this last year we've taken an ultrasound. And so the doctors that go and the orthopedic surgeons that come with us, we can assess how bad that tendon injury or muscle injury is, and then with ultrasound guidance and injection, we can heal those. This is a small hospital. Was basically a pediatric hospital, and does it's a center of excellence for plastic surgery, for individuals that have had a split in their lip, a cleft lip or a cleft palate. And it really makes speech difficult, and if it's properly surgically repaired, as they have brought doctors like us in, only these are plastic surgeons, they have got 80% of those children with normal speech. Huge, huge in terms of their schooling, their employment later on, and so on. We join forces with a group of orthopedic surgeons with a very good friend of mine in a clinic in Victoria called Rebalance, and Norgrove has operated on 500 club feet. And so this is a deformed foot that's very stiff, very rigid, and some, if we get to them early with physiotherapy, which we take with us, our physiotherapists, we get them into orthotics, or in many cases it needs surgery. And now they're a center of excellence for sport and exercise medicine. And we've been very lucky working with them and helping their athletes. They're very good athletes. And in fact, they won the African zone for rugby sevens. And when we first went there, half of them were injured. We work with because I'm a marathon runner, I work with their marathoners and distance runners, and their marathoner who was continually suffering from overuse injury. So we not only examine the athletes, but we teach. We teach the coaches, we teach the physios, we teach the athletes themselves on how much running can you do? How many days rest do you need? What about stretching? What about strength? And this athlete at the London Olympics, all of a sudden is moving up through the field. The press people are going through their press book. Who is this guy? We don't even know what country he's from. And he won. Unfortunately, he won the marathon, which was tremendous, but then got injured again. So he started coaching. So he coached a junior girl and a junior boy. They went to Berlin and they won the junior half marathon championships. And then this last year, they held the World Cross Country Championships. And for the very, very first time, they got 5 runners in the top 10, which is huge. So we're making a difference. But now our whole fundraiser is to save Corsu, this hospital, because COVID has really been major disruption of their economy. And so that hospital is close to going into bankruptcy. The other thing that we've done, a friend of mine got 1,000 acres in Mission on the lake. And so we're now fundraising and developing a national health and fitness institute. So we're building a boathouse, trails going around the 1,000 acres, putting in a track naturally, putting in 3 fields for all ages, putting in a gym. A good friend of mine puts in at least 20 NBA basketball courts, did ours when I was director of Fortius, a sports medicine center and an athlete development center in Burnaby. We're putting in a 200-bed hotel and gym and and restaurant. I've been very, very lucky in terms of Rick Hansen's a very good friend of mine. He was wheeling around the world, man in motion. I was his doctor. I ran across the prairies with him in the winter. We ran twice a day, 50 to 60 miles. I've been honored by 6 halls of fame. The Burnaby Hall of Fame, the Richmond Wall of Fame, and I was there because I was the chief medical officer. I had been to 8 Olympics, as a medical officer, chief medical officer for the Sydney Olympics in 2000. And then for 4.5 years, I was the chief medical officer for the Winter Olympics. And because of that, they said that the program that I developed for the Winter Olympics and the Paralympics was best ever. So they've now recognized me as and it was my team basically, but I've been recognized as the best ever chief medical officer. So I mentor the next Summer Olympics from Tokyo, which will be delayed till July 2021 because of COVID, and the Winter Olympic doctor who in Beijing puts that on. I was inducted into the Hall of Fame at Simon Fraser. At Simon Fraser, I played football, soccer, primarily a runner, as I was doing, the kinesiology. I've just been inducted very recently into the National Field Hockey Hall of Fame. So that's a tremendous honor for me after working 30 years with them. I've been president of the Canadian Academy of Sport and Exercise Medicine. That is the 800 doctors that do sports medicine in Canada, and they've given me a lifelong membership award and given me a award as the very first award for service. I started the Provincial Sports Medicine Council, and we look after the BC athletes. I co-founded the first, at that stage, and only road running club called Lionsgate. And then it was out of that, with two of us, we started the Vancouver Marathon. It's going to be 50 years this year. We started another race. It's the longest lasting 10K in the country called the Seawall Race. Many may have heard of that. And then Cheryl and I started the Sun Run. And I was race director for 20 years. And I brought my partner in, Doug Clement, and he had a great track club, and we needed volunteers. And now I put on Pro-Am bike races. And my race in Super Week is called the Poco Grand Prix, and I also coordinate medical for the only internationally cycling acclaimed road race for women in the Tour de Delta. So I've been very, very fortunate. I've allowed a hobby go wild. Through the activities I've done, hopefully I've improved sport and exercise coverage. Was a huge job with 2010 as a chief medical officer because you look after public health. And I had H1N1 to deal with, which is very similar to COVID. Fortunately, we got a vaccine, but I had to vaccinate, and with my team, 25,000 volunteers, 10,000 media, all our food services people, 3,000, the 5,000 organizing committee from VANOC, and then obviously look after all the athletes and the IOC people, anti-doping. I'm in charge of anti-doping. So I ended up having to raise myself, because we were under budget, $7.2 million. And that was for all of the medical equipment in our two 10,000 square foot polyclinics in Vancouver and Whistler. So you're looking after public health, you're looking after disaster planning, we're looking after terrorism, we're looking after the media, we're obviously looking after, the athletes. So that was a tremendous honor to be selected. I'd been chief medical officer at two Pan American Games, and chief medical officer at two World Student Games. So that I certainly was not a fundraiser, but I found that I had to. Now everybody jokes and said, well, Jack could sell carpets. But it's been tremendous. It's an outstanding field. You work with a variety of other specialties, and it's just tremendous that we now have a specialty for sport and exercise medicine. So if you're interested in activity, science, health, give sport and exercise medicine a thought. And a very good access to that is through kinesiology. So thank you very much. It's been an honor to speak with you. And if you have any questions, you can always contact me, and I'm more than willing to talk to you about the benefits of sports medicine. Thank you very, very much.